Well, since the bushfires began burning last year, health professionals have been warning the public about the hazards of bushfire smoke, advising people to wear masks and spend more time indoors. But that's not possible for firefighters on the front line, and it could have long-term consequences for their health. Andrew Orfanos is the president of the Australian Institute of Occupational Hygienists, an organisation that seeks to prevent ill health caused by the environment in which people work. He's written to the Health Minister highlighting the potential long-term health risks associated with inhaling bushfire smoke. Andrew Orfanos, welcome to the program.
Thank you for having me.
What did you say in that letter?
So in that letter, we want the Federal Minister and the State and Territory Ministers to, first and foremost, to congratulate them on the great work and effort they've been doing in trying to support our first responders. Secondly, to make them aware of the potential long-term health effects that we need to be monitoring. So once the bushfires are out, we don't necessarily just forget about our volunteer firefighters and first responders. We still need to be monitoring and looking out for them just to make sure we don't see anything similar to what happened with first responders at 9/11.
Now, when you talk about first responders, just be clear about who it is you're talking about. It's not just firefighters, is it?
No, it's emergency services, it's the police, any volunteers that help, it's the volunteer firefighters as well.
Now, you draw this link to the 9/11 attack in the US. What link do you see there?
It's not a link, it's something we can learn from. And what we've found, what people have found, researchers have found with 9/11, that at the start of early 2018, 2,000 people had died post 9/11 to illnesses associated with exposures to dusts, fumes and gases. And the experts were confident that by 2020 there would actually be more people who have been killed by cancers and long-term illnesses compared to the number that are actually killed on the day.
And is that a similar scale of risk that we're expected to see here in Australia because of these bushfires?
Not necessarily, but it's something we want to keep in mind. And so once the bushfires are out, we don't want to be sort of out of mind, out of sight. We still want to be tracking our firefighters that were doing that work and looking for signs and symptoms of health-related effects. Not now, over the years. So it's something we have to consistently do from now on.
What elements and factors of firefighting and being a first responder carrying the most risk?
Well, normally, with a lot of hazards that people are exposed to in the workplace and in bushfires, it's exposure and dose. So obviously, the more time they're spent at the front there battling the fires, and the more that they're actually exposed to the dust and fumes and gases that have been generated by the fires.
What diseases or conditions are firefighters then at risk of developing from those fumes and gases and smoke, as you say?
Okay, so the acute ones, eye irritation, nose irritation, then it can cause longer-term effects. It could trigger asthma, respiratory conditions, bronchitis, and then it can have effects on the immune system and also thyroid system, and could potentially long-term can even cause an increased risk of cancers.
And so some of those symptoms may not necessarily appear for quite some time.
Absolutely, and that's why it's really important that we don't forget what they have been exposed to and what they've been doing. Similar to what's happened with the workers of silicosis and coal workers pneumoconioses, the diseases that they die of 10, 20, 30, 40 years after they've been exposed.
Another factor in many of these fires right around the country is the amount of asbestos that's been set loose because of the fires and destroyed properties and damaged properties. How much of a risk does that pose?
It's actually probably not as much as what people are led to believe. Asbestos was actually used because of its insulative properties. So it actually doesn't burn. What happens though is under extreme pressures, the cement binding, the asbestos cement sheetings heats up and explodes. And so what we end up happening, these cement sheets blow off and sort of produce 50-cent piece sized pieces of asbestos that go everywhere. Now they're not actually direct harm to people, but there's stuff that potentially could down the track, and we need to be cleaning it up. So asbestos really is more of an issue when we're cleaning up the mess of the fires.
And again, prolonged exposure is the issue here.
Prolonged exposure, and also the asbestos needs to be in a in a form respirable. It needs to be small enough to actually get into our lungs to cause harm. And that only really happens when you sand, cut asbestos and generate dust.
Do you expect that, given the scale of this bushfire season, we'll see a wave of disease in the coming years? And is there anything that can be done now to mitigate that?
Look, we're not trying to be alarmist, but what we want to do is to learn on past experiences. And look, the reality is they will, because of what they've been exposed to, they are likely to be at more greater risk of these long-term health effects. So we need to monitor that. And that's what I've communicated to the Federal Minister and the State and Territory Ministers, is that we need to have something in place to be able to actually monitor their health and wellbeing, health going forward, so that if there's signs and symptoms of early onset of diseases such as cancer, we can pick it up at an early stage and actually protect them from dying from it.
Have you heard back from the Minister yet, and will you be chasing up a response if you haven't so?
We've announced it today, this morning, that we've written to him, so we'd expect to get a response fairly soon, I think, given the gravity and the interest that everyone has on this topic.
Andrew Orfanos, good to have you on the program. Thanks for joining us.
You're very welcome.